Trigeminal neuralgia, a royal pain in my face. It's known as the worst pain to man. I've had it for 8 years. It's also nicknamed the suicide disease because 25% of the people that have it kill themselves. It's something I've dealt with. The trigeminal nerve is the 5th cranial nerve in your face. It comes up the back of your spine, over your ears, to your temple. There are 3 main branches on both sides of your face, one across your forehead, one across the upper jaw and lower jaw. When it gets injured, you experience excruciating pain, disabling pain, debilitating pain. It's horrible. How do you get it? A blow to the head, a sports injury, car accident, a dental procedure, the zoster virus, shingles, MS, a facelift. Anything that can damage the nerve will set it off. Generally, people get it when an artery lays against the nerve. And the pulsing of that artery makes the nerve fire, and it goes into your face. The best way I can describe it is to show you a picture. I saw this picture on my trigeminal website, and I identified with it immediately. You get burning, stabbing, excruciating pain. It's like having somebody put an ice pick in your cheek. Taking a taser and buzzing it. It doesn't go away. I couldn't wrinkle my nose like that. It feels like your head's going to blow off. When you get it, you don't know what to do. You take your facial movement for granted. All the things that you do with your face, your smiling, your speaking, your movement, that's handled by the trigeminal nerve, the 5th cranial nerve. Once it stops working, you don't work very well. Some of the things it does to you, you can't talk. You can't eat. You can't drink. I couldn't bite a banana. I couldn't take yogurt off a spoon. You can't brush your teeth. I could do a whole speech on that. That's an adventure. You can't wash your face without pain because the slightest touch sets it off. You totally can't work with your face. The wind sets it off. If you walk, the movement of walking sets it off. You're in so much pain, you want to be comforted. But when you're in this pain, the ones you love can't comfort you because the minute they touch you, you recoil because the pain hurts so bad. Bud couldn't touch me. He couldn't hug me. He couldn't even kiss me on the forehead because I would recoil in pain. Imagine how frustrating it is for him to not be able to comfort me. And in turn, how frustrating it is for me to not be comforted. I had to find a solution. When it first started, for many people with trigeminal neuralgia, it generally starts in a branch in your face, either in your jaw or over your forehead. If it's over your forehead, people get diagnosed with migraines. In your jaw, you immediately go to the dentist. You think, oh, I need a root canal. Something is really wrong. I went to my dentist. He x-rayed. He said, your teeth are fine. But I was still having pain. I got this pain when I fell and hit my head. It took a few weeks before it started acting up. And one night I was laying in bed and I laid my head down on the pillow and I got a buzzing, like a little taser. I didn't pay a whole lot of attention to it because it went away. But then it kept getting worse. After the dentist, I went to the primary. She sent me to a neurologist. We were trying to figure out what to do. They give you drugs for it. They're anti-seizure drugs, anticonvulsives, that are supposed to calm it down. They didn't work for me. After I went to the neurologist, and she sent me to a surgeon who told me he wanted to cut my temple open, and he said, "You're too young for this. This is something we do to 80-year-olds. You shouldn't be here." I gave up on that neurologist. She wasn't going to touch me anymore. I decided to investigate on my own and find a solution. I went online, and I studied everything I could find about trigeminal neuralgia. Treatments, how you get it, who gets it. I came up with several ways to treat it. There's needles that they put in your face. They inject glycerol, or they put a balloon in the nerve, and it's called balloon compression. What it does is destroy the nerve in your face. And the consequences of that is you have permanent numbness. Just like when the dentist puts Novocaine in your face, that's the nerve he's treating. And you would permanently have no feeling in your face. Pain would be gone, but your mouth might droop. Another way to treat it is called MVD, microvascular decompression. That's major brain surgery. They go in right here behind your head, and they lift the offending artery that's laying against the nerve, and they put a Teflon felt pad between the two. And then they sew you back up, staple you up. That's major brain surgery. 6 to 8 weeks or more of recovery, possible stroke risk, possible anesthetic problem. I didn't want that either. I had to find a solution. What I found in the beginning was chiropractic and acupuncture. That worked for quite a while, until I couldn't stand it anymore. We went for a few years and calmed it down. I was able to function. At that point in time, I was okay. But then on Halloween weekend in 2011, I had the absolute worst attack I have ever had. On a scale of 1 to 10, I was 25-30. It was horrible. I went to the primary. I said, I got to have a new neurologist. So I went to a new neurologist. He gave me more medication. Didn't work. The day I had that attack, I went in that week, and I couldn't talk to him. Couldn't open my mouth. I had to write everything down. I wrote down at the end of my note, after all of my symptoms, I can't take this anymore. I need to see a neurosurgeon. You've got to help me. That day, he sent me over to the hospital, and I had IV steroids for 5 days in a row. That really messes with your body, and it didn't work. I was at the point where I had to have either heavy narcotics or surgery. The name he gave me of the doctor at North Shore University Hospital System was Dr. Gail Russo. She was a specialist in trigeminal neuralgia. And as I had been doing all my homework and learning about all the different treatments, I came up with 2 more. Gamma knife surgery. You have to go in and have a halo, a metal halo put on your head. It's screwed into your head, so you'll have scars from the screws. You're then put into a machine that has a fan of radiation beams. It looks like a fan if you look it up, and it goes into one and treats your problem. It's very common. A lot of doctors use it, and it can be very successful. The other, what I really wanted, was called the CyberKnife. CyberKnife of Chicago, the machine that saved my life, literally. It's called stereotactic radiosurgery, and this is the robotic arm that works on it. It has cylinders that are inserted here, and these are some more. They're bored out in different sizes for the different types of treatments that they use. This is a machine that's also used on cancerous tumors, and very successfully, because I found out about it from a friend who had 2 lymph nodes totally destroyed, and the most successful cancer surgery she had. So I investigated this, and I wanted this machine. You lay your head right there. Prior to going in, you go and you have an MRI and a CAT scan, and then they fit you with a mesh mask because your head has to be immobilized while you're on the machine. The day I went in, all I did was bring my music. I took the regular medication I was taking. I didn't have to take any kind of anesthetic, anti-anxiety. I was thrilled to be there. I didn't care about anti-anxiety meds. I wanted to lay down there and have that done and have a solution. This machine is wonderful. I got in there, I laid down for an hour and a half. That's how long the treatment took. Afterwards, I got up and I went in to a recovery room, and I looked like that. I reminded myself of a Captain Kirk Star Trek episode where there was a doctor, a scientist on a planet, and his wife had been taken over by an alien and she had to suck salt out of people. Sorry, I went to a strange place. But that's what I felt like I looked like. She had put her fingers on and sucked all my salt out. I felt good. I didn't have pain. It went away. I could smile. See the corner of my face? It moved. I was thrilled. Like I said, this machine saved my life. In comparison, these are the two Nancys. This is Nancy in major pain. Can you tell? That smile is about all you got out of me. That is the day after. I look about 20 pounds later. I can smile, way smile. I am living proof that if you have a major medical problem or any kind of problem that's really bringing you down, you go and you do your due diligence, you investigate, you become proactive, you find the doctor that will work with you, and you be the active patient that knows what they're talking about. I went in there with all my information, said, this is what I want, and they said, yes, you do. They were great. I'm up here in front of you. 16 months ago, you wouldn't have seen me. I wouldn't have been able to stand up here and give a speech, let alone talk. But now I'm a Toastmaster. And I hope I have raised your awareness a little bit about this condition. Because many times, people look fine on the outside, but you can't tell what's going on the inside. And we are trying to get a Trigeminal Neuralgia Awareness Day on October 7th. And this is the website. I have handouts for you. We're trying to get 10,000 signatures to get on the docket of the World Health Organization. And I have a website you can go to. And if you would help us sign up, we're trying to get it done. You have no obligation. Just put your signature down. Nobody will call you. Nobody asks for money. We're trying to get the awareness across the world because there are many sufferers. I am a lucky one. I don't have pain anymore. Thank you, Mr. Trustee.